Welcome to yet another motherfucking episode of Horrible Decisions. I'm your girl, Mandii B, a.k.a. Pet the Stallion, a.k.a. Dat Bitch, a.k.a. Full Core Pumps, a.k.a. Pagan Markle, bitch.
I'm just Weezy, and we are here with, her name is Heather, but she's actually Black. And
but also a doctor. So y'all, we got a doctor in the house.
I'm not the only Black Heather out there.
You're not?
I'm not. It's so crazy. My cousin, who also grew up in the Bronx, is also named Heather because my family.
Heather from the Bronx?
There's two Heathers from the Bronx.
And you have blonde braids, bitch. I'm confused.
And we both Black.
Well, I'm excited to have you guys. We did have a doctor. We've had a few healthcare professionals here on Horrible Decisions.
Mm-hmm. Our last OBGYN we had on was Dr. Christina. And I think before that we had on, we've talked about the vagina, maybe just Michelle Hope, just like professionals in the industry. But I mean, our pussies are changing. They're getting older. So
Exactly. So you need new.
I need vaginal rejuvenation and a conversation about what's going on down there.
Why do you need vaginal rejuvenation though? Like, why do you need it?
Okay, so I did this TV show called Sex Cells, and I went to this place called the V-Spot. And they have this menu of all the different things you could do with your vagina. Right. A woman from the Real Housewives owns it. I don't know if you've ever heard about this place, but at the V-Spot, yeah. And actually, she was great. She said the V stood for vulva, and she was like, we just want to make sure women can take care of their bodies. And she's like, we do vaginal rejuvenation. I went on this fucking thing to tighten my Kegels, and it was like a mile a minute, electrocuting me. It was fun though. But now I want vaginal rejuvenation because it's I heard it's a vaginal, and they basically make your pussy even tighter. Not yet, but once I pop the baby out.
Yeah, because I'm if you do it now, it may get too tight, and then you're not able to do what you actually want to do.
I want it to be super. I want to be oh my God, sorry.
Can I also ask you?
Only fucked one guy before.
Well, only because I'm a super fan, Stan, and she just brought up Real Housewives. Mm-hmm. Do you watch Married to Medicine, and do you like the representation of Black women doctors on that show?
So,
because Andy gonna Andy. Andy is good.
Andy Cohen is someone who I appreciate because I'm always entertained. And honestly, Married to Medicine, I don't think does a terrible job. Okay. I think it's honest. It's real in certain respects. People always expect doctors to be these people who don't fight, who don't drink, who don't curse, and we do all of those things. So I kind of like showing that side of us. And I think it does fine with Black women because I feel the Black doctors on there are working. I know some of them personally, and I know some of them in professional settings, and they're people who work. You know what I mean?
So, Dr. Heather, can you go ahead before we really get into the good shit? Okay. Get into the guts. Of this episode. Can you let our audience know what type of doctor you are?
So I'm an OBGYN, so that's an obstetrician gynecologist.
You just being pussies.
Basically.
I know that's right.
Have you, if you said you listened to our show before, how'd you find Horrible Decisions?
So basically the reason why I even ended up finding your lovely program is that I'm always trying to find ways to not shock myself when patients come to me with different things, right? So I want to know what people are doing in the streets. So
they're doing lemon cream pies.
That part.
They're doing lots of
Do you know what that means?
You know what that is?
Well, I know what the cream pie part
Take a guess. If it's yellow.
I mean, is there urine involved?
Yeah.
Interesting.
Inside the
Thank you for backing us up there.
Interesting. Well, urine is sterile, so I mean,
did you hear about the Alabama Hot Pocket episode?
Oh. No, I did not hear about that.
It's when you close your ears, kids, shit in a pussy.
And so that's not as great.
I don't think our listeners do it. We do have some middle America folks now, but I feel like they're elevated. But that sounds real down home to me.
Yeah.
When you're so bored, you just let me just shit
in pussy.
Let's figure out different things for us to do.
No,
that part.
When you listen to Horrible, have you heard us say anything wrong about vaginal health? And if so, did it strike a chord where you're oh my God? Or something that we asked a question about where you're I need to come on this show?
A few things. But I mean, I feel so when I usually see people, the pussy's broken. Vagina broken. She's sad.
Maybe it's dry as hell.
Maybe it's dry.
Maybe it smells.
Maybe it's not smelling right.
Said, well,
I thought you were going to sing it with me. You didn't.
What?
Insecure.
Broken pussy.
Broken pussy.
Oh, I know.
Maybe it's dry as hell. Maybe it really smells. Broken pussy.
Hey.
which I don't have.
Well, we're going to get into a little bit of the vaginal things later. I did want to start off as well because you are also an educator as well as a medical professional. I wanted to know, for the icebreaker of this episode, 3 ways that we have all been failed by sex education. So could you share with us 3 things that we all should have learned in sex ed early on that most of us did not?
Well, 1, the vagina should smell like a vagina.
Okay.
That part.
That's
That part.
huge.
If you had to describe it to someone that didn't have a nose, what would you say?
But if they didn't have a nose, would they be able to smell?
Look, real quick with it.
Bitch, you know what I'm saying? Like, yeah, because like I agree, right? Like I've heard that said so many times, vagina should smell like a vagina. It's not supposed to smell like flowers
Or water.
But what is it? How do you describe that? I think mine just has a natural musk, and I like the smell of it. But I also don't know how to describe it.
Perfect.
Yeah, I don't really know how to describe it either, but I know what it shouldn't smell like.
That part.
You know what I mean? So it's like when you
We was at a live
eliminate
show.
things.
We went to a live show in Atlanta, and they also traveled and came to another live show. And he literally sat next to his girlfriend and said that her vagina smelled like salmon.
Oh, he
And
said it with an L.
He said it with an L, and we were just like, the whole audience was just like, oh no, honey, no.
Wait, did he say that about the smell?
What else would it?
Like in the present, he was talking about her? I mean, that's what I meant. I'm sorry.
She was right next to him.
I thought he meant in the past.
Regardless, she was right
The
next
past,
to him.
as in wear your mask, past. What? You're telling me he was talking about the bitch next
You were there. We've talked about this before.
I just,
What?
I don't know why that
and so,
is
like,
awful.
and of course, fish is not something that is a good
that's
smell.
not. No,
Not at
it's
all.
Like, and
what
healthy
it's supposed to-
vagina doesn't smell like fish.
No.
To be honest, even the fried fish don't be smelling that good. I mean, it does.
Like fried fish don't.
Even sushi doesn't
Fish
smell like
just don't smell good ever. Is there any good smelling fish?
No,
Not really.
no.
No, right? I mean, salmon with butter and capers kind of be hitting. I'd be like,
But now you add and add it. You doing?
oh, I
extra
am
shit.
adding extra shit.
If you
Yeah,
put it
that
in
was
garlic like capers.
I was gonna say, you add some
and
thyme and
butter.
rosemary and shit. That thing be smelling kind of good.
Bro,
But
I
that
had
doesn't
crab
spice it.
legs on my hands the other day, and it was nighttime, and I was around my mom, and I got drunk. I was like, I can't even masturbate now. Shit's gonna last for days. My mom was laughing, and she goes, maybe we'll like scrub it with lemon or something. What can we do? And I was like, I don't need you to help me masturbate to get rid of the fish smell. She's like, I know, but you're right. You can't put it up there.
Oh,
Then it's really gonna smell like
it
fish.
is gonna really smell like
Right.
fish. Oof.
No.
Okay, so outside of vagina should smell like vagina, give us 2 more that we should have learned early on.
So another big thing is that sex shouldn't hurt. And
Okay.
a lot of people get that thought because people talk about losing virginities. And like, so they're like, oh, when you lose your virginity, it may hurt. And then some people don't realize that that's like not a continual thing.
Is the cherry popping a real thing?
For some people,
Yeah.
yes.
Okay.
For Hymen, right? Like,
Well, I mean, I know that's one of,
people.
even when I was looking up sex myths, like the idea of a cherry popping, not everyone's cherry pops.
well, maybe because it did in another way. They say the gym, riding a bike. It could have happened to you before, but if I'm not mistaken, everyone has a hymen, correct?
Yeah.
Every
Well,
born
yes.
female.
But again, it's not associated directly with sex all the time, which is why even when we
Exactly.
talked about the TI thing, the idea that he was checking on his daughter's hymen was just like,
Did yours? Do you remember a moment where it happened to you, or you don't remember?
no, I don't know.
You don't.
Exactly. And most
Yeah,
people
I don't. Yeah, I don't.
And most people don't have that experience.
You don't either. I remember like vividly.
Yeah.
Bro, it went down my leg. The
Really?
blood. It was bad.
Yeah. I must have been like riding a whole bunch of bicycles.
I'm like,
Maybe you felt right at home on a dick, and you were like,
yeah, I was like, all right then.
But you know what? I have heavy periods now. Maybe that's why. I just been bleeding the whole time. Mandii barely has periods. She got
I don't.
So
I
maybe
do.
you
Well,
don't
it's
have
only
that
because I'm one of God's chosen. That's all. Like, we know this 3-day period, me baby.
You were so lucky.
I'm so blessed.
How long are yours?
Mine are like 6 days.
Oh,
And I'm like, so I have 6 days of bleeding. And then the 6 days before, I'm like,
A bitch.
well,
Or crying?
I'm crying. Like,
Me too.
it's like today, right? Because I
cried 30
I
days.
will share, I am definitely in that pre-period luteal phase, right? And so today, somebody was telling me about how they're surprising their grandma, and she's in her 90s, and they haven't seen her since before the pandemic. And I'm like, I love those videos. Send me a video of that so I can cry. And I'm like, who am I? Who the hell is that?
It's weird, but I want it too. I want you to send it to me.
Right?
Oh,
We all want to post this on the horrible decision.
I love the surprise videos of
I know. I was like, I'm tearing up just thinking about this right now.
Okay, no, that's way too emotional.
Yeah.
Dude.
And what's number 3?
I love that.
Give me number 3 that we should have learned early on.
Yeah, so number 3 is that you shouldn't be cleaning inside your vagina, right? And that your vagina and vulva are 2 separate things.
Why?
So I'm giving
why
a
the
fourth
hell,
bonus.
Why the hell was them douches, the Summer's Eve bullshit douches, like introduced as something that we should do?
Because they got money. And so they're paying for advertisements and things like that. Because the feminine care industry is a multi-million dollar industry.
I'm in it now.
And so it's a very, these people.
Everybody wants their vagina to smell like flowers. We're always assuming that it smells bad. I remember when I was like younger, I wasn't even having sex yet, and I bought a douche. Didn't know how to use it, had never even put a tampon in, and I was like, well, I have to smell good. Like, what if I get fingered tonight? Like, just dumb shit. And I think that the association to the smell not needing to smell like a vagina, like it has to smell like something else, is the problem. Also, when you walk down the aisle, I was just in Walgreens. So I use something from Whole Foods. It's a natural vaginal wash. And I've been using it for like 4 years. Now, I ran out, had to go to Walgreens, and I was like, yo, there's nothing here. Like, I literally used water and like, I think whatever plain soap I had for just the outside, like I didn't even want to touch the lips. I was freaking out because everything I looked at had this name: Midnight Flower, Rose Garden, blah. And I'm like, nigga, what? Yeah. If I smell like a candle in my pussy, it ain't right.
I also think the important thing too, and I don't think like the important, like I'll literally wash my whole body and then I'll put, like I have the little loofah for my hand. So I wash my whole body, and then once all the soap is gone, then I go in with just my bare hands because I think a lot of people don't understand as well, because I know us black folks be using loofahs and washcloths. The white folks don't even use water, but...
or shower.
Or shower at all. But the loofah...
Oh my God, stop. We have new white listeners after Girls Gotta Eat.
Maybe. I mean,
we have 35.
And guess what? They still don't shower. It doesn't matter if they listen to us on another pod.
So I'm helping your new white listeners out.
But no, like even just learning the importance, again, as a fucking adult, like you shouldn't even be using your wash rag to go in there and clean the outside, because of course it has all of your Dove soap or whatever you use. And then also, like, a lot of people aren't just changing out their loofahs and washcloths every day. So also just that bacteria that you washed off, you're now entering into your fucking
and it's sitting in the mildewy shower. Like, I'm not even kidding. I came home after 2 weeks, right? And I was like, what smells wet? Oof. And when I picked up the loofah, I was like, oh my God, the last time I was here, I could smell it. It smelled old. Imagine if I didn't think for a moment, I would have just been scrubbing all that old shit.
Yeah. See? Yep. Well, let's get into, if you are listening to us for the very first time today because you just love that we brought the education and shit, our vanilla shit segment gives you sex in the news. Okay. And for this one, girl, we talking STDs, okay? Okay.
No. So speaking of which, my panties are so tight.
What that got to do with STDs?
I'm like, BB.
Oh, I'm like, that ain't got nothing to do with STDs now.
I'm fucking around.
Yeah.
But no, BB, I remember like when I was younger, my mom was like, don't sit with them wet swimsuits and make sure them panties are loose and they cotton.
Yes.
Well, I wanted to let you guys know, don't blame our show for this, but this marks the 6th consecutive year of record-breaking cases of sexually transmitted disease in the U.S. And y'all, I'm about to give you the 10 states that are the highest in there. And if it's your state, you might just want to go get
Florida,
tested.
Georgia.
In 2019, there were more than 2.5 million cases of chlamydia, gonorrhea, and syphilis reported, according to the CDC prevention. The CDC's data looked at states with the highest cases of chlamydia, gonorrhea, syphilis, and congenital syphilis. What is congenital syphilis? That's a different type of syphilis?
So that's if your mama had syphilis and gave it to you as like when you were...
Oh, as a child.
Yeah,
because it was in your blood.
You were in utero and your mom had syphilis and you got it that way.
Damn. And could you get rid of that?
Not really, because it causes certain birth defects that you have for like the rest of your life.
Oh, shit.
So be careful out there, guys.
Nigga,
is that not something that's tested on women before giving birth?
Yep, we test you. And we test you and treat you if you are positive.
Oh, wow.
It's a thing.
Oh, wow.
Niggas ain't shit. My homegirl got gonorrhea while she was pregnant.
Yep.
And I remember she was freaking out.
I would have been so pissed.
Oh, wow.
Because, and this is when I was in high school. I think maybe he might have been her second partner.
Right.
And she was so scared and everybody was freaking out about it because they didn't know what medicine, what dosage to give her because she had a high risk pregnancy. And we really need to just keep in mind, like, the fallopian tubes and STDs, people make jokes, and I do about like, oh, I'll just take a pill and get rid of it. But like, it's a lot of damage long term.
Especially if you don't catch it.
If you don't catch it early.
And that's the thing. A lot of women aren't in tune enough with their body to even realize a change.
Yep.
But also, there are so many of these STDs that some people may not even see symptoms.
Like chlamydia.
I didn't even get symptoms from fucking COVID. So there's that.
Chlamydia doesn't have
Chlamydia
symptoms,
is my greatest
symptoms. Yeah.
fear. Sometimes I look at my nigga, like when he came back from a long night out, and I'm like, I'm gonna tell you right now. I'm still going every quarter.
Speaking of the clap,
Yep.
we're going to talk about the 10 states with the most cases of chlamydia. And you had 1 out of 10 correct, Weezy. Georgia is in there. So we have Alaska, Mississippi, Louisiana, South Carolina, New Mexico, North Carolina, Georgia, Alabama, New York, and Illinois.
Dozen fuckers.
The state that ranked the lowest was actually New Hampshire, but also I don't know anyone that lives there.
But Alaska, we don't know anyone who lives there either. But maybe that's because
But what are they doing?
They fucking?
How far
Banging
is
each
the
other.
convenience store? Can you really go get a condom?
I mean, in Alaska, yeah.
And it's
And I don't
always,
think they have that accent in Alaska.
I know. I wanted to do it. God damn. That's why we
like
live in
it.
a small community accent. This is not Southern. This is like, we live in a place where we don't have stores like that. A condom for what? I'm going to pull it out and shoot it on her butt.
Christ.
One of the other things that I actually as well wanted to share, because this is a motherfucking black ass podcast, the CDC data actually illustrates that STD rates were 1 to 2 times higher for Hispanic and Latino populations.
Ouch.
And rates for American Indian, Alaska Native, Native Hawaiian, and other Pacific Islander populations were 3 to 5 times higher.
So we okay.
Wait. Data also showed, y'all ready?
I was like, we ain't
ready for
okay,
this
y'all.
black ass stat?
Y'all ain't ready for
do
this.
it.
Data showed that STD rates were 5 to 8 times higher among black
Now
populations.
the 35 listeners are like, and take that, Amanda.
So the thing is, I have a 2-part question to this. For the CDC, this says that these are all stats from 2019. And so it's 2021. Why are these stats almost 2 years old?
So you have to understand that different health departments have different criteria for how you report these, right? So any clinic you go to, private, public, they all have to get this data. And it takes a while. And it depends on what state you're from, because we're talking about places like Alaska. We're talking about places like Florida. We're talking about
what does that mean? What does that mean?
where it may not be centralized. It may not be a central type of way that they collect all this data. So it takes a while to get all of the data for the whole country.
Florida is fucking up votes for the presidency and our STD stats.
Wow.
Probably.
God
Probably.
damn, why are we from there?
Dude,
Not we.
They're just embarrassing.
Florida
Y'all.
cannot get their shit together
Ever.
in any place I've ever been tested.
I hate it.
The Planned Parenthood, and then I go to this place called The Center. It's an LGBTQ friendly place. If you want to have a free test, go over there. I always go when I'm downtown because I'm like, oh, it's so easy there. You go, you pee in a cup, you just need your ID. So this is fucked up because I'm like giving the place props at the same time. I peed in this Dixie cup with no cover,
Nice.
handed it to the girl, and I was like, okay, when do I know? And she's like, well, if we call you, you'll know. I was like, so bitch, I'm gonna panic for how long? Like, that is the worst.
A little while.
You know what I'm saying?
For
Can
a
you give me
while.
a twist top, my nigga?
Not a the second question that I had for you, based on even how it's been for you working during COVID, do you predict that those numbers will go down because so many people were locked in their homes, or do you feel like it would also continue to rise for our 2020 stats?
I think it actually might go down, to be honest.
do? Okay, that's what I was
because
thinking.
I do think that people just kind of buddied up and figured it out. I mean, but of the people,
Like me, that's how I got a boyfriend.
look at you.
You what?
Look at God.
Well, no, he's gone now, but it was cute while it lasted.
Well, good for you.
Yeah, that part.
Yeah.
Hey, as long as he left with And you left the relationship with no STD?
Yeah, no.
I think we win.
We were good and clean the whole time. I loved it. I loved it for us.
Come on.
You know what I mean? Damn, look at us.
I think you guys win.
So yeah, I mean, I guess I agree as well. Have you had as many scares? And also, can you talk about where you had been? Like, where do you work? What part of New York?
The Bronx, the boogie down.
Even though I'm in Queens now, but
I'm in Queens too now. I live in
Queens.
Queens.
That shout out Castle Hill, Park Chester. Let's go, 6th Street.
I grew up in Park Chester.
Let's go, everybody.
Okay, now they speaking Spanish.
1 to 6.
Okay, and is it private? Is it?
So I work for the public hospital system. I see any and everybody, people who have insurance, people who don't have insurance, people who got their immigration papers straight, people who don't. I see everybody.
What is the easiest way for someone that does not have insurance to get access to STD testing, or what would you recommend?
So the free clinic works.
I know that's right. They sure do.
The free clinic works, and there's a lot of different iterations of free clinics, right? So in the hospital where I am, we have clinic space in the hospital, and we work to whatever, income you have, right? So if you don't have money, we'll see you. If you, make a little something, we have a sliding scale.
We're going to tax you a little $12 just
a little
because
bit.
We need something,
I know, because we got to keep these lights on,
We need it.
Yeah.
We got to be able to order the test, y'all.
I went to a free clinic when we first quit our job years ago for STD testing, and I had a really shitty experience because it was like, I waited like 6 hours to be seen, and then once I got seen, they were like asking me how much I made my last pay stub, but then my pay stub was too close to when I went. And I was like, nigga, I don't have a job no more. I know what it said, but damn. And I mean, I couldn't even be seen that day until they determined that my income was low enough to get fucking tested for free. And they wouldn't even take the sample. And then once they did take the sample, they said if something came back wrong, they're like, well, what do you want to test for? I was like, well, I want to test for everything. And then they started breaking down that gonorrhea cost more, chlamydia was cheaper. And I'm like, man.
And they don't even, and we've talked about this on the show. We've had a few episodes around herpes simplex. That is an actual test because they assume everyone has some number of it. I think there's 8.
There's 8 different types.
And so that's one that they will only test you for if you ask, because it's a different cost than just the basic chlamydia, syphilis, trick, and there's one more. The basic one.
Gonorrhea, chlamydia. Well, I test everybody for gonorrhea, chlamydia, HIV.
Of course.
People be forgetting the HIV, and it's still out in these streets. And Black women, we are still the highest people getting new cases of HIV. It's bad. It's really, really bad.
I was going to go out tonight and have some fun, and I want to stay in the house.
Yeah,
I mean, you could go out without having sex.
I know, but now I'm just
or you
scared.
can have sex and just not get HIV.
No, bitch, I'm just scared.
You know what I mean? Like, yeah.
I'm just saying.
You can use a condom. There's options here. Have sex.
I mean, I know, but it's not 100% guaranteed. The safest sex is abstinence, and I've been abstinent.
Good Lord.
And
here we go.
It's scarier, bro.
I hear the Florida coming out.
I'm being really serious. Y'all can joke all you want. When you are not fucking and then you start fucking again, you almost get anxiety on top of when I'm fucking, this shit don't come across my mind. But not fucking right now, I'm like, oh God. Oh, now I'm going to jump into it. You're more freaked out.
It's true. That's actually true for a lot of people.
But the cuddling is kind of fun and intense. Though.
Oh my God.
Because everybody's respecting the fact that I really don't want to fuck right now. So it's really intense foreplay and humping.
That's nice. That's also sweet.
Not her hunching.
I'd be like, don't put it in.
Not her being childish hunching and shit. Girl, you better just cuddle or don't do nothing. Because that hunch is just you know what, bitch, now you're a child. Fuck.
It's kind of fun.
Oh my goodness.
I
want to get into our hors d'oeuvre. And of course, our hors d'oeuvre segment is where we get a sex tip from you. Okay. However, one of the things that I ran across in an article that I also saw you mention on your page, but also look at you. You ain't even know the outline. You mentioned it as one of the things that we should learn early on in having sex. So I wanted to give a tip to all of the women based on this actually is an article from Everyday Health. Eden, I'll include it in the description of this episode.
Gotcha.
But it says, why is it so hard to speak up about painful sex? So you are actually, I believe, featured in discussing this, but painful sex actually has a name. It's called That's the name of it.
Dyspareunia.
Thank you.
You're welcome.
Bitch, it was like...
I was like, vaginismus?
Dyspareunia?
Vaginismus, though, you're in the right area because actually vaginismus can cause dyspareunia.
Oh, so...
Dyspareunia?
Dyspareunia.
Like the fruit.
Like petunia?
Dyspareunia.
Dyspareunia.
It started
that word, dyspareunia. So I actually wanted to ask.
It don't sound like it feel good either.
Outside of vaginismus, outside of dyspareunia, which is actually, a reason for painful sex, what are other reasons as to why a woman may be experiencing painful sex? And then I would like you to also share with our audience a tip on how they can communicate that sex is just really painful for them. So let's start with the first one. What other reasons could it be that the sex is painful?
So I like to tell people to split it up into kind of sex when the penis is going in or whatever is going into the vagina, and what we call deep dyspareunia. So like when the penis is deeper, right? Because it's really important to know the difference because it can be due to different things. Okay. So vaginismus, which is when your pelvic floor muscles kind of spasm, that usually causes more what we call superficial dyspareunia or more pain in the vagina and maybe even closer to the outer part.
Okay.
And so the treatments are somewhat different. Deeper dyspareunia could be due to things like fibroids, endometriosis. You could have had pelvic inflammatory disease or PID in the past, and now you have some scar tissue in there. Sometimes it can be due to sexual trauma you had before. So there's a lot of different reasons why you can have deep dyspareunia, and sometimes you can have both.
I wanted to also add, and we'll talk about this in the horrible decision, but also just you can tear inside, not only from pregnancy, clearly that thing pop you right open, but if you're not wet enough, if you're not moist enough, if there's not enough lubricant, you can start pretty much getting like a rug burn inside your pussy.
Oh, yes, you can.
And so that can cause it to hurt. So even though you think she moaning, it might
be pain.
It's really painful. So can you give a tip to our audience for all the ladies listening, if they're with partners that they really love and they really do enjoy having sex, but it's also painful and unenjoyable at the same time, what tips would you give to them in communicating that?
Right. So I definitely just be really upfront. Like, I think what happens is that a lot of times we use euphemisms or we're like, oh, I'm going to hurt somebody's feelings. But like, if it hurts you, it shouldn't hurt. Additionally, I find there's a lot of stigma against using lube. Like, I don't get why people feel like lube is a bad thing.
It's supposed to be water falling down there.
For one, if men are celebrating, and it's much like the pressure on women for a rock hard dick,
right?
For on men to have a rock hard dick that women may be giving or whatever partner. I think that particularly with men, even in music, pussy being super wet, these are things that you feel like are supposed to naturally happen, right? Like no one feels good about having to like, spit on it. You want to be super soaked. And I think the experience is what someone's going to remember more than if it was your pussy that got wet or the lube.
Right.
I mean, at the end of the day, would you rather have broken pussy, dry ass pussy, or a little bit of they didn't sponsor this podcast lube?
Right. True that. And I actually agree with that so much because I feel like so many people and so many conversations I have with especially women as they're getting older, because when you're getting older, like when you are going towards menopause or whatever, or even people who just had a baby because your hormones change, you can get drier. And so they're like, oh, what's wrong with me? And it's like, girl, this is life. Like, this is not you. This is not
my greatest fear is that happening to me. I just know it's going to happen. Something's always wrong with me. I'm allergic to everything. That shit's always fucked up. I just know when I pop that baby out, they're going to be like, your pussy got broke when it came out. So I'm going to request a C-section just so I know my pussy might be okay. Do you deliver babies, by the way?
I do.
How many times out of 10 do they shit on the table?
Do you want me to truly answer that? Most times.
10 out of 10?
Not 10, but like maybe 9.
I also want to ask you, and this is vanilla shit. This is another thing that I saw in the news article. Okay. and I want to know your opinion on this because I believe it happened here in New York City.
Okay.
There is a crisis in which a hospital lost all of their nurses who deliver babies due to them not wanting to get vaccinated. Yeah. And so now there's a whole area where they can't deliver babies because they're not staffed enough. What are your thoughts on that? And at this very moment, YouTube is probably going to put the CDC.gov goddamn stamp at the bottom of us. But I would like to know your thoughts on even that, being that you do deliver babies.
Well, I think it's really unfortunate. I actually know that area because homegirls had some jobs. So I've been here, there, and everywhere. And that place is rural as hell. It's country as hell. They already had access issues with people getting appropriate obstetric care, meaning care for pregnancy, for deliveries, and things like that. The fact that they're closing that down because of it is messed up. And these people know each other.
All right. Well, enough about the goddamn COVID vaccine. And
can you get COVID in your pussy? Have someone asked you that?
Yes, I have been. I work in the Bronx. Of course, I've been asked that.
And no. Seriously, and like, if someone goes down on me with COVID,
can I get COVID there? Yeah, they have asked. And
at least you have a mask on when you laugh about it.
I mean, I laugh audibly, so they knew. I was like, really? And they're like, yeah, no, really. And I'm like, I mean, you can't get COVID specifically in your pussy, but you could get COVID kind of in your body. Yeah.
Okay, got it.
It is a mucous membrane.
What's the dumbest shit someone's asked you? And what your opinion? Because they say there's no dumb questions, but there kind of are.
I'm trying to think if there is like dumb questions.
Or maybe let's just say something that kind of like, what the fuck? Blew your mind a little.
You're like an educator. Ain't you supposed to say no question is a dumb question?
Man, but you're on horrible decisions.
I know, but there really aren't any because there are people who really don't know.
Yeah.
And I don't think that it's their fault for not knowing. It's just life.
And I think also you're in a spiral too when you're the doctor. You just start asking everything.
Yes, and people are really nervous. And
I ask my OBGYN everything. I'd be like, and I'm getting headaches. What that mean?
Yes. People will be telling me, oh, and then my toe hurt. Like, are you going to do something about it? No. I'm like, do you want me deal, or their teeth? I'm like, do you really want me? You a doctor,
you better know how to work my whole body.
Yeah, but do you really want me to be filling a cavity? Right. Like, I mean, I deal with your vagina. Like, do you want me to really be doing dental work for you?
Oof.
When it comes to like the vagina though, right? Like it's so close to the asshole. Like when people have asshole issues, are you the whole area?
I mean, there's some asshole things that I can deal with, like hemorrhoids, I kind of deal with. And then there's some conditions when you get older, prolapse. So, yeah. So the uterus can come down, your rectum can start prolapsing, and so can the bladder. Oh, well, rosebud is like coming out the butt, but there's a way that your rectum can start coming out your vagina.
Wait, excuse me?
Wow.
So like...
Took a wrong turn.
Your ass... Wait, your booty hole could come out of your...
Well, not like your... Well, so there's the anus, which is the booty hole. And then there's the rectum, which is above the anus, right? So that's inside.
The little tube where the shit come out.
Yeah, and that's inside, right? That's above. So the back wall of your vagina shares some real estate with the rectum. And if that back wall of your vagina gets weak, it can kind of pooch out, and actually your rectum, like it's called a rectocele, it can actually pooch into your vagina.
So I have one question about that.
Rectocele.
I have one question about that only because, of course, Future even made it popular with the thumb in your butt. But I do know that when I have a finger in my ass and a dick in my vagina, he can feel his finger in my ass. Is there anything where that could actually like... Could he puncture that little lining at all, or is that not a thing?
I mean, he would have to be extremely aggressive.
Okay.
And probably never cut his nails, and again, be extremely aggressive to puncture it. And I have never seen that.
You've never seen it? Okay, knock on wood. I don't know.
Hopefully I never see that.
What's the weirdest thing you've seen?
Knock on wood.
So I had a patient once who forgot she left a juice, like a juicy juice box in her vagina.
Ah, okay. Maybe she was a little thirsty.
Excuse me?
Why I don't know why she put it there, and she didn't remember why she put it there. I mean, she had some mental illness issues, but she was being brought to us by... I know, but she was being brought to us
because it wasn't fun anymore
for a smell, and she was like, no, like
not the Juicy Juice box.
Yeah, because I was pulling out pieces of it, and I was like, "What is this?"
Did you put it together like a puzzle?
No.
How the hell you know I got all of it now? If it was in pieces, you know what I mean? Like you said by pieces, I want to know if you made a puzzle.
Do you remember what flavor it was?
Yeah, it was grape.
Not it was grape.
No, don't tell me she was.
It
black.
was purple drink. I don't know. It was purple.
She said purple drink.
It was purple.
I hear about like tampons being like left up there for a while, and condoms.
A lot of
the condoms are common, I guess.
That's how this show started.
And tampons are.
Do you recommend the OB no string having condoms? Like, or are those ones?
Tampons?
Are they called OB?
Yeah,
okay, I said condoms. Yeah. That I remember always seeing that when I was like younger. Like, well, how does it work? But like, they literally don't even have casing.
Yeah, you just
are those the ones that get stuck?
No, it's really what happens is people forget that they have a tampon in, I feel like, and maybe they like their period was light that day and they were like, okay, let's just put one in, and then they go about their lives and they forget, and then they start having issues with discharge and smells. And then they're like, wait a minute. A lot of times they come in and then I do the exam and I'm like, I found the reason why you have a smell.
I love that. That's like
they've been in there.
Usually at least since the last period, and it could be like a month.
I mean, I've had a friend with one stuck for just a week, but that actually leads us into our horrible decision. I'm so excited.
Your face, man.
Y'all read the title for this week's episode. The horrible decision for this week is scents and feels.
Okay.
So the first question that I actually did have, again, we're getting back to sex, but still the gushy medical stuff as well. Mm-hmm. Let's get into it. Scents and smells. First question. Should I have sex if my scent is off? Is it healthy to fuck through BV, yeast, or any other reason as to why my pussy's smell is not normal? One moment, this comes because I was recently at a sex club. Again, if you join Patreon, it was the first time I was at a sex club where I walked into a room and I said, there's no way she doesn't smell that too.
Damn.
And I was just like, everyone in the room was having sex. So it was clearly one of the women. And I was just like,
is it just me that's where people say that you could smell it right now in the moment?
Like that is where I was just like
sonically, you're listening to this. Are you in my car and you too smell tilapia?
Oh, not tilapia.
Not the farm raised man-made
Branchino on this. I'm going with tilapia.
But yeah, I wanted to know if there was any health concern or reasons why we should not have sex if our pussy smells.
Well, so the thing that's going on is that your pH is off, right?
Right.
And now, especially with something like BV, the bacteria has overgrown, right? So the issue is that you can make the situation worse because basically it depends on, condom usage, non-condom usage, and your partner. But there's a possibility that, so when you have BV, your vagina is more basic, right? So in terms of acid-base chemistry, and semen is basic. So that means that it can make the BV worse, and it can actually usually make the smell worse.
Oh,
so
his cum can make the smell worse. Yeah. So he should pull out if it already stinks.
I mean, but there's also pre-cum, so there's that. And also too, like that kind of stuff can get on a penis, and then you have to know like your partner's like hygiene issues,
Because men have pH as well.
Oh yeah, and they, and circumcised, uncircumcised too. So some of that bacteria can get stuck in the foreskin. There's a lot of things that can happen. So I mean, the answer technically is sure, you can do whatever you want, but it's probably not a great idea. And it probably doesn't feel that great.
Now, we don't kink shame here, right? But we do, like I've given golden showers. We both said we really wouldn't be into scat play, but also there's anal sex.
Right.
So I did want to know, are there a lot of bacterial concerns with anal sex and golden showers? And is it actually bad for our bodies to engage in?
So in terms of golden showers, so urine is usually sterile. So there tends to be no bacteria unless you have a UTI.
Wait, what?
Can I ask you, like, and this is just a thought I have while high all the time. Cool. Pee is sterile, but all my toxins are coming out of it at the same time. Yeah. What is in the pee that's making it the jellyfish thing? What is up with the pee, bruh? What is it?
This is a great question. I actually really love this question. So in terms of toxins, we're talking about like chemical toxins. Mm-hmm. So that would be like nitrites or nitrogen containing things.
Come on, science.
Like acidic things. But
and that's when your pee is bubbly?
No.
What?
When men pee, they say when men like have the foamy pee or whatever, like if your pee comes out and it's foamy, it's like it could be healthy. I was like trying to.
Yeah, it can be.
Yeah.
Right.
Oh,
When
so
it's
I thought
foamy?
Yeah, sometimes it depends.
look, now Ed's about to learn about his piss.
He's going to be examining it.
Like, ooh.
But it's more so like in terms of like the types
Vitamins?
of things you eat, vitamins, things like that. That it's a big chemistry, like
science.
I Googled that because a dude that I slept with, damn, I don't remember how long ago it was, but I was like, damn, does this nigga got some shit? Because I was watching him pee. And I remember Googling it and I was like, okay, the foam cool. Because I was like, is it like discharge for men? Like, I really didn't know. So pee is sterile. You said it's the chemical toxins.
Yeah, it's chemical toxins. So it's not actual like bacteria or anything like that.
So you could drink it.
I mean, yeah, you could actually. So usually in places, let's say you get stranded.
I thought she was going to say in places where where do people drink it the most?
Oh my God.
When they're stranded.
When they're stranded in the middle of nowhere and they're going to die and it's an option between drink that dirty like pool water or my own piss, I'm going to drink my own piss. And I just said that.
Really?
No, I mean,
out here letting us know you about to drink your piss. Okay, but life or death. Life or death. Speaking of, again, just pH, and we talked about this earlier, you did a great job without even knowing anything we were talking about today. I wanted to know, outside of our mental concerns regarding just how we think our pussies should just be wet, I want to know, is lube something that will throw off our pH? And is lube something that then could also make us smell later?
That's a great question. And the answer is it can. Oftentimes it doesn't though, because most lubes are formulated for the vaginal pH. And most lubes don't have things that should throw things off. However, we're all different, right?
Yes.
So some of us are more sensitive than others. So you may have a reaction to lube because you may have a reaction to certain things in that lube that may, throw off your pH.
The same like condoms.
Right.
I actually always had a pretty sensitive pussy. Like I said, everything's always wrong with me. But no matter the lube I've used, after I just feel not like burning, but a little just like something's there. Like I'm aware of my vagina. Like I notice it. Maybe it's like tingly, like always water, like the oily ones, the fucking anything, the natural shit, organic lube, like no matter what. So now the only thing I've done just a little bit differently is the lightest layer and rub it into their penis. Like that's the only thing I've done. Whereas before I might put it on my hands and rub it on my vulva. Now it's the opposite if I need it.
Right.
But I mean, it is scary when you're just like, what works? Or just throw water in my mouth and try to get as much spit as I can. Yeah. That's my fave.
There's that.
Spit's the best.
But it can dry out.
Yeah.
Steer pussy.
Yeah.
Or spit.
Yeah.
Oh, the spit. Yeah.
And then it can also dry out.
And spit has bacteria.
That's true.
Spit, we have the dirtiest mouths of everything.
I mean, I'm sucking dick before I fuck, so there's not really there's no way around it.
You're like, let's be real.
I'm gonna be like, look, I'm gonna hope that the onion soup is out of my mouth, but like, I just ate it. Sorry, that's why it was on my mind.
The last one in the horrible decision has to do with feels. And this is because we have a lot of kinksters that listen in.
Okay.
So this is a question for anyone interested in fisting, gaping, double penetration, or size queens.
Okay.
Will my holes ever be tight again?
Most times, yeah. Because so in terms of, we're talking about buttholes or we're talking about vagina.
Let's talk about buttholes.
So, okay. Most of these holes have muscle around them and connective tissue, which is collagen, right? And so that allows for some level of elasticity. So they should be able to stretch and then go back, right? So that's why people's vaginas don't stay as big as that newborn baby. It goes back, right?
Is there a time frame from that? Like if I fuck a big dick nigga one night, will the little dick nigga know I had a big dick in me the night before?
Unlikely.
Really?
Unlikely.
Within
For
24 hours?
Yeah, like usually
goes
within
right
a
back.
few minutes. So like even looking at a
shit.
vagina
Well,
after.
Oh, shit.
That makes things fun.
Within a few minutes?
Within a few minutes, you should be back to where you were before.
So
Elastic-
cheaters, you're going to be okay.
Yeah.
Yeah. So if
Holy
people
shit.
claim they feel a difference, they're just trying to like get something out of you. It's not necessarily that they feel anything different.
Interesting.
That is actually
I can
very
confirm
interesting.
I love that. I love that.
Well, before we get out of here, I found a home mail that I feel like only you could have answered.
Okay.
If we're getting into the health shit. So this is actually from one of our male listeners.
It's a interesting one.
Yeah, I'm excited about it. So it says, hey, y'all, huge fan of the show and recently started from the beginning. I've known about horrible decisions for a while now, but never gave it a shot. But after Mandii started doing her other pod and after Weezy created the pod studio, I thought it was time to pay attention to y'all. Geez, thanks. He said, I mean, 20...
Like he was coming up for a live show.
like, damn, were you waiting to see us really prosper?
He's here
Fuck.
now, you know?
Maybe because visually people like watching it.
There you go.
Maybe
See?
that works too.
Just a second
he
You're being
said-
kind.
You know, he said, I'm a 28-year-old bi-Hispanic male that's still a virgin.
Latino.
I know.
Oh, wow.
That's probably why it took him so long to listen.
Wow.
But anyway, sorry. He said, I have gotten head, eaten pussy, and done a
right.
lot of vanilla shit, but never have penetrated. I have this condition called phimosis. Not sure if you guys know what that is, but basically the foreskin of my dick is too tight. It doesn't pull back behind the head, and I'm self-conscious about it. Some women and men like it, others don't. I've always been scared to have sex because I think the foreskin will rip when I penetrate. I'm too much in my head and it affects my ability to get hard when it comes down to someone wanting to fuck me. I've considered getting circumcised, but I'm being a bitch and it terrifies me. I actually don't mind having foreskin. I just wish it was regular and pulled back and forth effortlessly. Also, I don't have schmegma. And I hate how uncircumcised dicks have the rep of coming with schmegma. I have had my dick for 28 years and I know how to clean it.
Good
So
for
basically,
him.
have you guys ever heard of this condition and if women or men actually have that as a kink? Love the show, y'all's energy. Keep it going. Sincerely, the Riverside guy.
I love that question.
It's a great one.
Right?
It's a great one. And I mean, in terms of phimosis, I've heard of it.
Okay.
And a lot of times we hear about it when it's actually painful. So not only does it like not retract the foreskin, but it actually kind of suffocates it.
Whoa.
And so it can be sometimes a surgical emergency for my colleagues who are urologists where they have to like come in and like snippy snip.
Does he? Can he do the thing where he? You know how like men want to grow their foreskin back? Can he like do the stretching to maybe?
I mean, potentially, or he can also get circumcised, or if there's any like, you know, scar tissue or some type of tissue that's holding up the foreskin from being able to be pulled back, there may be techniques they can use to kind of free it up a little bit.
Now, circumcision as an adult for men that maybe even still be wanting to consider it now, they lose even more of their sensation, correct? Because
And it's super painful.
Is it covered in
Okay.
insurance?
No. And even actually,
Really?
did you know that baby circumcision is also not covered by insurance?
Whoa.
wait, seriously?
How much is it?
That I don't know because I don't do them.
No, I
yeah.
heard that it's $16,000 on average in the country to deliver a baby.
Yeah.
So that's why I was like curious, like
Yeah.
if someone had to throw that in there.
Because that is an option of the parent. Do
It is
you
an
want
option.
your child circumcised or not? And I know
It
here
is
in
an
America,
option.
a lot of the
lot
men
of people
I fuck
do.
are circumcised.
And a lot of people do. And it's not something that has always been the case. Like insurance companies did pay for them in the past, but most insurance companies don't. Because
Interesting.
because before the thought about circumcising was that it decreases infection, especially things like transmission for HIV. That's what they thought. But then they did further studies that show that that's not actually the case. And it's actually just primarily cosmetic or cultural. And
Cosmetic.
that's
The
what
look
they
of it.
say.
Honestly,
Wow.
I have never minded uncircumcised penises, but I feel like other women do. And just
Yeah, I
the
do.
fact that there's a girl out there that could talk about my son's dick in a disparaging way, that's the only reason I'd do it.
Really?
Just save him.
But I'm like, oh my gosh.
I'm gonna save you from these hoes. But then
nice
the other thing, in
turtleneck.
terms of pleasure, hearing that men and by the way, someone that has given blowjobs to someone who's circumcised and uncircumcised. Oh my God, uncircumcised dudes, making way more fucking noise when I suck their dick or even touch them certain ways. And I'm like, why are you nodding? Are you uncircumcised?
No, I'm just appreciate the dick sucking. Loves getting my dick sucked over here.
Yeah, that was a head nod. Like, yep,
I was like,
yep,
I still got mine.
Sex flashbacks were hitting me. That's,
Team extra skin.
Yeah. No. I'm circumcised here.
I just watched the Sex and the City episode where Charlotte was dating a guy who had foreskin and he wanted to get circumcised. And it was really funny because when you said it was painful, they started making out and it was like after surgery. And he got hard and he was like, oh.
Damn.
And I was like,
can you not be like under when they do that?
Oh no, you're put to sleep. You are put to sleep for it. But I mean, you wake up, somebody cut your foreskin off. That's on your penis.
Like when I got my tits done, right? Didn't feel it, but it still hurt.
Yeah, I'm sure.
You know what I'm saying? Like I was under, but then like I fucking vacuuming. Oh man.
Yeah.
That shit. That's when I knew that the tits weren't mine. Every time I vacuum, sometimes to this day.
Really?
10 years later, I'll just notice it. But back then, it was pain. I had to get a little step ladder to like reach up.
Wow.
Damn.
It was worth it though.
You were like, I loved every minute.
Oh man. Who knows where my life would be without tits? I don't.
Good for you.
Well, Dr. Heather, you also now have a podcast out.
I do.
You are educating the girls, and it just launched this month. So if you could go ahead and let all of our followers know where to find you, where they can, because you're really active and really good at the TikTokers, and I don't know how to do that.
I know.
But you do really good. Your Instagram is so informative. This whole outline, by the way, came from her motherfucking Instagram. So can you let us know a little bit about your podcast name and also where everyone can find you on social media?
Yes. So my podcast is Dr. Heather's Advisory Cervix. So
Cute. I love one.
Yeah. So I'm going to be talking about like all things reproductive and sexual health. Seriously, it's going to be like no question is left unanswered. No topic is left undiscussed. So you can definitely hear from me and all of the people that I bring on. I'll have other doctors on there. I'll have just like, and like my friends, actually. Like my friends. My girls
Remember when you had a UTI, girl? Come on.
Come on, talk to us.
I love that you're even doing that because that's kind of how we started this podcast. Weezy and I were just really inviting our friends.
Oh shit, my friend, Dr. Kim.
We had a.
She was our first doctor.
We were just like inviting our friends on, and honestly, even before I launched Period Sis, I was like, I know all y'all got pussy stories, so I need y'all on my podcast. So I love that you're doing that, but also bringing other healthcare professionals. And then could you share also your @name and where they can find you? And do you have a website as well?
Yeah, I do. So you can find me on TikTok, on Instagram at Dr. Heather Irobunda, MD.
Heather what?
Irobunda.
Irobunda, yes.
It's like a
You definitely said it quick like it was Heather Williams. You're like, Heather.
Irobunda.
That's beautiful.
Hot.
Yeah, it's from Nigeria.
Is it African?
I'm a African.
If you're from Africa.
You said a African?
I'm a African because
African.
I'm half Jamaican, half Nigerian.
Cute.
Bullet.
We like you. So that's your IG handle. And what's your website? Or your TikTok?
And my TikTok's the same handle.
Nice.
And then my website is Irobunda MD.
Cool.
Irobunda MD. Guys, all of that information will be in the description of this episode. And as always, we are also going to leave you guys off with a 5-minute bonus clip from one of our bonus episodes over on Patreon. That's right. If you're all caught up, we drop an additional episode every week. In one of the episodes each month, we join you guys on Zoom and y'all are able to be a part of our conversation and episodes. So if you haven't yet, go on over to patreon.com/Horrible Decisions. It is there. Again, that link is in the description of this bio. Weezy, do you have anything else to send us out of here?
Yes, if you are enjoying watching these episodes on YouTube, Mandii and I recorded WTF Media Studios. Come on down. You might have Eden, you might have Dave, you might have Yomi Wolf. We have amazing engineers, and we now have a new studio room. You may have seen it when we did our solo episode. Come and fuck with us at Canal Street Market.
All right, well, guys, thank you so much again, Dr. Heather, for joining us. And this has been yet another episode of Horrible Decisions.
Bye.
Bye.